Hi everyone, in this video we want to warn you about a considerable drug interaction in pediatrics. An interaction between the elixir formulations, which may contain up to 25% of alcohol in them, and metronidazole. The administration of these formulations together, elixir formulations and metronidazole, may lead to disulfiram-like reaction. What is this reaction? In this phenomenon called disulfiram-like reaction, the consumption of alcohol may lead to increased amount of acetaldehyde in the body, which may lead to diaphoresis, hypotension, tachycardia, palpitation, nausea, vomiting, which are all annoying symptoms for pediatrics. So, these formulations should not be administered together. In many situations, we may administer these two medications together. For example, in a kid with some kind of giardiasis and diarrhea, the physician may administer metronidazole for controlling the infection and also the dicyclomine elixir for controlling the spasms, which all this may lead to disulfiram-like reaction. So, note that elixir formulations should not be administered with metronidazole. It is not good. Hope you enjoyed this video. Please like, subscribe, and share. And also don't forget to ask your questions in the comments. Thanks.